We have EU Ambassador, Ms. Nona Dupre, as the chair of the event. Welcome, Nona.
My name is Nona Dupre. I'm the European Union Ambassador to Nepal. As such, I'm absolutely not specialized in digital, so I'm very happy to be on this panel and listen to the specialists. At the start of her tenure, European Commission President Ursula von der Leyen, she launched two parallel transformations, digital transformation and the EU Green Deal, which is there to become the first climate neutral continent by 2050. And they are really both needed because digital technologies are crucial also for us to achieve decarbonization. But at the same time, digital technologies need to undergo their own green transformation. So I would like to give the EU perspective to this debate.
I'm Sagar Prazuri, youth and gender activist, public health practitioner. My academic background is public health, and today I'll be reflecting on the digitalization in the health system, and I'll be analyzing or reflecting on the digital connectivity and use from the GESI perspective, gender equality and social inclusion perspective, and from the mental health perspective. And recently, I worked with the government of Nepal, Department of Health Services, for the unified data management and analysis system for COVID-19 prevention and control, epidemic forecasting and prediction. So I have been working on the different. I provided the technical support to the Bhimat municipality Tanau for epidemic COVID-19 prevention and control through different initiatives.
Thank you, Sagarji. Can we have a round of applause for all our panel members? Yes. Thank you, everyone. Now we enter into our round of discussions. As we know, COVID is the current topic. Our topic is centered around the impact of COVID. So I'll start with my questioning. Sagarji just mentioned about his experience working in health system, the digitalization of health system. So I'll start with you, Sagarji. Can you share what's the main learning from your experience in terms of how it has impacted your working modalities and how you digitize the health system and your partnership with the government as well? Thank you.
Thank you so much. Again, we are back in 2019 when we have the first case of COVID-19, and again in 2022 we are even discussing COVID. So it's all about the COVID. So basically, I will be focusing on the digitalization approaches that has been taken in the Nepal for COVID-19 prevention and control. COVID, also known as the first global pandemic of the digital age. Everything changed in a day. When we got the first case of COVID-19, and our system has a limited surge capacity, and with the limited surge capacity, and the health service provider will have to again adapt to the digitalization in a quick way because we don't have any options available, and every sector have to explore the digital potential, and the health sector was the one system which cannot wait till the COVID-19 cases can decline, because the day we reported the COVID-19 cases, then the health system has to be ready to adopt to the digitalization. And there was the two burden, because we have the COVID-19 cases that was a new cases, and by side we have to continue the essential healthcare services by side also. So the system was overstressed because we have the limited health service provider, and we were not prepared at all because it was a global pandemic. So emergency and immediate digital solution became in our immediate necessity. There was no option. We cannot say let's wait for the COVID, then we can act. So it became an immediate solution, and essential. And by side we have to focus on the essential healthcare services. So healthcare service provider and the system became compelled to digitalize or have to undergo the digitalization process. And at the beginning, we can see there was a lot of infodemic. There was all about the COVID. When you go into the Facebook, when you go into the Twitter, when you go into the everywhere, there was the COVID. So a lot of myths, humor, and the misinformation were circulating, and there were a lot of information. And we saw the people sharing the best fact and information, which created the fear among the public. So by side, there was the digitalization was the one approach for the health system to tackle with it, but the government has to prioritize the risk communication and the community engagement strategy to make the communication not so linear. we have to respond to the public what myth and rumor are circulating around the communities. So even the government took that steps at the early phase of the COVID-19. And by side, there were the different innovations and the intervention were digitalized. Like we can see there was the COVID-19 system checker in the different mobile application where we can know whether whether the symptoms I'm having are similar to COVID-19 or not. So that way system was digitalized. And similarly, the government, I guess, if anyone had the COVID-19 in Kathmandu or out of the district, I guess they received a call on 6, 9 days of their COVID-19 because the system was digitalized. We had a system that is called Information Management Unit at government system. It was so quick. It connected the 3 levels of actors: municipalities, lab, and the hospitals. If you go for the COVID, if you went for the COVID-19 testing, for the PCR testing, then automatically your personal details or the social demographic details were digitalized. And even if you are not letting your municipalities know, the system, the information went to the municipalities, and they can know whether you are positive or negative or whether your result is inconclusive without any communication between that channel. It was all digitalized. And if you were positive, then there used to go the blink on their mobile application, and they have to immediately start the contact tracing and case investigation. So this way the system was digitalized. So to contact every close contact of the cases, and to have the to know whether which provinces or which geographical areas or which ethnic groups are having the high number of cases, so the national level interventions or policies can be guided. So similarly, it unified the data management system, so which helped us for the epidemiological prospective analysis and for making the plans. Similarly, we continued the essential healthcare services through the teleconsultation services and the telecounseling services, because we cannot wait till the COVID will decline. And similarly, different partners, NGOs, and the different IT companies develop the different tools to digitalize the health services. We have the real-time max monitoring initiative taken by the UNICEF. Similarly, GIS tool were used for the COVID-19 monitoring. And we now, from the government perspective, we have the COVID-19 portals where you can see the real-time data of the COVID, where we can, the daily reporting of the cases. Similarly, vaccination, good practices reporting, health sectors, and the health facility registry and hospital. Different initiatives are being taken by the government. And now the main point is these were some initiatives taken by the government. But why digitalization in health system is necessary is the main question I guess we want to hear. So the digitalization in health system makes the services easily accessible, because we can see a long, many people waiting for the health services at the government hospitals. So there is a scope that we can digitalize it, or we can make the appointment systems or make the functional linkages between the peoples. And similarly, we digitalize our system so quickly. There was no time. So it was circulating COVID-19 pandemic throughout our community. So whether that time the question was whether the digitalizing system, where they were easily accessible to all group of people or not. That was the question. Similarly, and what we realized is that there was the reluctancy to the digital tools, platforms developed at the various levels of service delivery, because the health worker, health service provider has to do the same function. They have to do same responsibility with the addition of the COVID-19. And so it makes them reluctant to learn the digital or to adapt to the digital health system. Similarly, there were the automated messages on different mobile application, softwares and toolwords developed. Similarly, and now what may be the way forward, or what may be the learning from the COVID-19, maybe we can have the electronic health record or electronic medical record in our upcoming days, and similarly individual health profile. And maybe the digitalization in health system could broaden the scope of the research purpose also. So the person after the birth, we can have his electronic health records, so we can track whether he were vaccinated with the basic vaccine immunization or not, or we can track what were the health problems or what were his conditions throughout his life. And so we can intervene accordingly, and can also help us for the research purposes also as well. So there were the different medical mobile apps developed. So I guess the COVID digitalization and the COVID-19 was the turning point for the digitalization health system. We got to learn a lot from the COVID-19. So it opened and it helped us to realize the health system and health sector to know our potentials and where we can go. And basically essential healthcare services and we can have the COVID-19 again and again. So it made us to realize our potential and the need to digitalize more health services again.
Thank you, Sagarji. I think it nicely sums up how our health sector, quickly adapted to the COVID situation, and it does bring back a vivid memory of, the early days of COVID-19, where you're trying to test that you are not COVID positive. So I think it was a good overview, and also, you correctly highlighted the access and, the digital divide situation, and rightly the opportunities moving forward. Nona, now I'd like to request, I think you can help us understand how Europe has changed, or didn't change, or what has the impact of the COVID, especially with the digital education. Although we know most of the developed countries, they were already equipped or utilizing those online platforms, but your own experience would be very grateful for our audience.
Thank you. I think COVID has led to a big debate in Europe about data protection. All of these online applications where all of our health data are just, where we want to make sure that our data are secure. And I think that is, it has been a very lively debate. Data protection has always been high on the priority for Europe. So I think we are now very well known for data protection. When you have to start clicking all of those things, do you want your data to be shared or not? Some people think it's a nuisance, but it is really there to protect our privacy and our data. And data is just power and money and might. And these data are just being used for artificial intelligence, and just to use us as consumers. So I think that is one way where the European Union would like to promote, global rules. And we can, I think, leverage those by having a big market. So we create these rules that are there to protect our citizens. And these are being adopted in other parts of the world too, because they want to be allowed onto the European market. So, for example, the data protection rules have been adopted by many countries in Asia, in Latin America. And I think that's a very good thing. Very recently also, European Commission and European Council, they agreed on something which is called the Digital Service Act. And I think that is also because I think the first speaker, alluded to it, about misinformation and disinformation, and you alluded to it about harassment. And that Digital Service Act is also, I think, a very, very important piece of legislation, because its intention is to make sure that everything which is illegal offline becomes illegal online. And we hope to also that Digital Service Act would be enforced in other parts of the world. So I think there are many pitfalls with digitalization, and many wonderful things, of course, because you are all in the field of digitalization, because it brings us together and it brings our societies and people closer to each other. But we also have to make sure that we promote an open, a sustainable, and a democratic society. So for us, it's very important that digital is at the service of the citizens and of society.
I think that's very important aspect of, digitalization that you highlighted, and definitely Nepal has a lot to learn, given how we have moved into an online system, and there's not enough protection against consumers and how their data is being utilized. So that's very correctly highlighted.
I think maybe now is a good moment to intervene on what we call Global Gateway, which is the European Union strategy to better connect the world, because you mentioned being in a remote district. So we really want to offer a credible choice for partners to invest in connecting people to people. So including in digital, in health, in education, and in transport. But what is very important for us is that it would be green and sustainable, but also that it would be transparent and that it would promote good governance. So the idea is absolutely not to create dependencies, but also only to invest where it's needed, where it's sustainable, so where we have really like an environmental impact assessment, and when it can also provide added value. And then it should also, of course, be always in line with human rights and democracy. So just wanted to mention this global gateway.
I think that's a very good opportunity. So now, slightly talking about the consequences, I would like to invite Sagarji to share his own experience, or rather, help us understand, how this, proliferation of, access to digital world has also impacted mental health, a lot of time, and how there is so less monitoring because of that, and how do we create a safe digital space, as Raksha is slightly tossed upon earlier, and how do we make it socially inclusive? So yeah, over to you, Sagarji.
Thank you so much. Seconding to all the panelists, when the COVID-19 pandemic began, I went to my home, which is in the rural area of Nepal, and yeah, even being so privileged and having access to all the digital tools, platform, and method, and having to certain level of information and idea about the digital tool, even it was a struggle for me to adapt into the digital spheres, spaces all around, because everything changed so quickly. So similarly, we can see the digital divide in terms of the resource available is mentioned, whether availability of internet or availability of the laptops, mobiles, and different things. Similarly, in terms of the digital skills that the young people or the people individual can have. Similarly, the quality of use divide we can see in after the immediate outcomes of the digitalization, immediate outcome of the rapid adaptation of the digitalization. Similarly, we can, with the COVID-19 pandemic, we saw as mentioned, epidemic of another epidemic. We saw the mental health issues arising throughout the globe. We saw the children, young people being at risk of cyberbullying, online grooming, hate speech discrimination. Similarly, we saw the increasing cases of the mental health issues. So it was the physical spaces and the digital space was completely different, because the physical spaces I have to meet someone in person, but in digital space I'm easily available and I can connect to anyone through the digital platform. So it was completely different, and it was somehow every individual has gone through the different struggles, because there was the insecurities and the uncertainties at the first of the pandemic. We don't know how long we have to wait. Everyone was waiting when we can have when we can normalize everything. So there was even some, due to lack of the digital skills, some of the individuals have to left their job, or company fire them because they do not have the digital. All of a sudden the COVID happened and they have to adjust into the systems. So there was the different mental and the social consequences. So the digital divide again wasn't a digital tools, method, and the platform we had wasn't able to reduce the inequalities we had before, but rather than it broadened the gap, or it broadened the digital divide, and so it resulted into the consequences in the socio-economic inequalities. Similarly, the digitalization in education put children at the risk of cyberbullying, online grooming, hate speech, and different social, different mental health issues. So we saw the increasing tendency of the suicidal tendencies, self-harm behavior, anxiety, depression, eating and sleeping disorder among the young people. These were just few numbers. We have more to go. So similarly, the COVID-19 pandemic limited us. Of a sudden, we have to sit in our room. We have to work digitally. Of a sudden, it changed. So it limited social and the cognitive development of the children. But as mentioned, the digitalization have the advantage and the disadvantage. Similarly, there was the digital space where the people can connect or can socialize to some moment, because we are getting back to normal again. But that time it limited social and the cognitive development of children. So so we cannot say that the digitalization has bring alert. It becomes a window of opportunity for us, because we realize our digital potential. We realize the need of digitalization in every sector, health, education, and every sector. So again, we have to move forward with, but what are the solutions we can manage? So how we can ensure the safe digital spaces, whether my data and internet are safe or not, or whether my information available there are safe or not, or privacy or confidentiality issues were there. So it's time we highlight, or we move forward again with the digitalization. prioritizing the cyber educations, educating young people about the risks and security. Similarly, building a cyber security resilience system at the national level, so that we can enjoy our digital rights and can feel safe at the digital spaces. That's all.
Sagarji, I think you rightly highlighted the digital device, was not the only reason. I mean, it also caused stress, and not just the content that we were consuming or how long we were consuming. I think that was very correct. And thank you for also giving us the options how we can, minimize some of the challenges. So with that, I actually we wrap the main discussions, but I would like to give the floor open for our, yes, we have a hand raised already. So yeah, the floor is open for questions. So given the time constraint, maybe we'll just have few questions. Please, your name and your question to the panel member.
Hello everyone, my name is Ajay Yadav. I'm a student of development studies. And election is coming up, and when we are talking about youth and digital connectivity, I do believe that the content of elections will be a very essential component to be discussed, but unfortunately we're not able to highlight on that aspect. So right now, when we see there is a campaign, election-related campaign, mostly from social media, that's very good thing because we are exploring new element, new way how we can promote ourselves. But if we look at the past, when we see incident like Arab Spring in Egypt or Tunisia, when these social media how driven the entire nation in a very undecided or very unpredictable ways. So my question is that do we have appropriate mechanisms to control these things? I don't know whether this question is relevant to any of the panelists, but if you have knowledge, please do share. And also regarding, initially I heard the term like misinformation, disinformation. The people who are residing in cities areas or urban areas, they do have the concept of this, but me, someone from representing from a very rural part of Nepal, I'm from southern part of Nepal and a very bordering area of Nepal and India. So I have seen the people or youth from my village, whenever they see a content, without doing any cross question, they just start sharing that post in their community, and that's a very serious issue. And I think, do we have appropriate mechanisms to, when we are currently celebrating digital connectivity, but are we prepared enough to, face the consequences that this digital connectivity might bring in the future? Thank you.
GESI, I think I will, agree to most of the things that you have said, like the contents that is being shared without the understanding of it. But I don't think we are any of the expert in the panel that can rightly answer your question. But I'll keep it open if anyone is interested to respond. Yes, Nona?
Yeah, thank you for this question. We've seen with digital technologies that indeed disinformation and misinformation increases by both state and non-state actors in many, many domains, including here in Nepal. And it is very difficult to counter because, of course, they have very massive resources at their disposals with trolls and whatever. But I think this is exactly what the European Union is trying to combat by making it illegal to post fake news and by making the platforms responsible for this websites that post the fake news, and so by making them accountable. So that is one way where we hope that those platforms will be made more accountable to delete some of the fake news. But of course, we have to make sure that this still respects human rights and freedom of expression. So it's a fine line, and I think it's very important that we are aware of both sides of that. Disinformation, misinformation, and fake news. And we have massive campaigns in the EU to dismantle fake news, to really, these fact checkers. I think that is really important. And also just campaigns to raise awareness on fake news. So we have a campaign saying, think twice before you share, and or check it before you share. I'm not saying this is the global panacea and will provide any the global response or the global solution to all of this fake news. But I think it's good to be aware and to start the fight against this disinformation, because we are being more and more polarized and more being surrounded by our own opinions. So it will be more and more difficult for each other to understand each other and to understand the opinion of the others, whereas we have to live together.
I think that was a very good example. I think that's a good takeaway. I'm sure we have a lot to learn yet to create those kind of mechanisms. Hopefully, we are moving towards that. Ajayji, stay tuned, and as we just Susie just highlighted, you know, the way to reach out to maximum audience is to reshare it again, rewatch it, rethink it. If you think it's applicable to your content, to your audience within your social media, then do share it further. So with that, I'll sign off. Thank you so much, everyone.